Question 1. A client with diabetic ketoacidosis, DKA, is receiving IV fluids and insulin. The nurse notes a sudden drop in potassium from 4.5 to 2.8 milliequivalent per liter. What is the priority action? A. Increase insulin infusion rate. B. Administer potassium replacement as ordered. C. Monitor urine output closely. D. Notify the healthcare provider immediately. Answer. B. Administer potassium replacement as ordered. Rationale. Insulin drives potassium into cells, risking hypokalemia, which can cause arrhythmias. Potassium replacement is essential before continuing insulin therapy. Question 2. A client with acute pancreatitis develops tetany, with positive CHVOST-X and Trousseau signs. Which lab value should the nurse anticipate? A. Hyperkalemia. B. Hypocalcemia. C. Hypermagnesemia. D. Hypoglycemia. Answer. B. Hypocalcemia. Rationale. Pancreatitis can cause fat saponification, leading to calcium binding and hypocalcemia, which manifests as tetany and positive CHVOST-X/Trousseau signs. Question 3. A nurse is caring for a client receiving aminoglycosides. Which assessment finding requires immediate intervention? A. Serum creatinine increase from baseline. B. Mild hearing loss reported by client. C. Decreased urine output to 500 milliliters per day. D. Complaints of dizziness and tinnitus. Answer. D. Complaints of dizziness and tinnitus. Rationale. Ototoxicity signs, dizziness, tinnitus, require prompt intervention to prevent permanent damage. Nephrotoxicity, creatinine output, is also important but less urgent than early ototoxicity. Question 4. A client with heart failure is prescribed furosemide. Which lab value requires immediate notification of the provider? A. Sodium 135 milliequivalent per liter. B. Potassium 2.8 milliequivalent per liter. C. Calcium 9.0 milligrams per deciliter. D. Magnesium 2.0 milligrams per deciliter. Answer. B. Potassium 2.8 milliequivalent per liter. Rationale. Hypokalemia can precipitate life-threatening arrhythmias in heart failure clients taking diuretics. Prompt correction is essential. Question 5. A nurse notes a client on heparin therapy has a platelet count of 80,000 per millimeter cube and reports new onset of leg pain and swelling. What is the priority nursing action? A. Continue heparin and apply compression stockings. B. Notify the provider and hold heparin. C. Administer vitamin K as ordered. D. Encourage ambulation. Answer. B. Notify the provider and hold heparin. Rationale. Thrombocytopenia and new thrombosis suggest heparin-induced thrombocytopenia, HIT, which requires stopping heparin immediately. Question 6. A client with severe asthma is prescribed albuterol nebulization every 2 hours. After the third treatment, the client reports palpitations and tremors. What should the nurse do? A. Hold further treatments and notify the provider. B. Continue treatments as scheduled. C. Administer a beta blocker to counteract side effects. D. Encourage deep breathing exercises. Answer. A. Hold further treatments and notify the provider. Rationale. Palpitations and tremors may indicate beta agonist toxicity. Treatment should be paused and provider notified. Question 7. A client is admitted with suspected myasthenic crisis. Which intervention should the nurse prioritize? A. Prepare for endotracheal intubation. B. Administer anticholinergic medication. C. Monitor for signs of autonomic hyperactivity. D. Provide frequent oral suctioning. Answer. A. Prepare for endotracheal intubation. Rationale. Myasthenic crisis causes severe muscle weakness, risking respiratory failure requiring airway support. Question 8. A client on warfarin presents with hematuria and an INR of 6.2. Which nursing action is most urgent? A. Hold warfarin and notify the provider immediately. B. Encourage increased vitamin K intake. C. Monitor vital signs every 4 hours. D. Administer protamine sulfate. Answer: A. Hold warfarin and notify the provider immediately. Rationale: elevated INR with active bleeding indicates risk of hemorrhage. Warfarin must be held and provider notified for reversal orders. Protamine sulfate reverses heparin, not warfarin. Question 9. A nurse is caring for a client with an indwelling urinary catheter who develops fever and flank pain. What is the priority nursing action? A. Remove the catheter immediately. B. Obtain urine culture and notify provider. C. Increase oral fluid intake. D. Administer antipyretics as ordered. Answer: B. Obtain urine culture and notify provider. Rationale: fever and flank pain suggest pyelonephritis. Prompt culture collection and provider notification are essential for appropriate antibiotic therapy. Question 10. A client receiving lithium therapy reports nausea, vomiting, and blurred vision. Serum lithium level is 2.1 milliequivalent per liter. What should the nurse do first? A. Encourage oral hydration. B. Hold lithium and notify the provider. C. Administer antiemetics. D. Monitor vital signs hourly. Answer: B. Hold lithium and notify the provider. Rationale: lithium toxicity occurs at levels greater than 1.5 milliequivalent per liter. Symptoms indicate toxicity and the medication should be withheld. Question 11. A client with chronic heart failure presents with 3+ pitting edema, dyspnea at rest, and an oxygen saturation of 88% on room air. What is the nurse's priority intervention? A. Elevate the legs and monitor edema. B. Administer supplemental oxygen and notify provider. C. Encourage fluid intake to reduce edema. D. Prepare the client for urgent dialysis. Answer: B. Administer supplemental oxygen and notify provider. Rationale: hypoxia and dyspnea indicate worsening heart failure and possible pulmonary edema requiring immediate oxygen and provider evaluation. Question 12. A nurse is caring for a client with Clostridium difficile infection. Which intervention best prevents spread to other patients? A. Use alcohol-based hand sanitizer after patient care. B. Wear gloves and gown when providing care. C. Clean equipment with regular disinfectant. D. Place the client in a semi-private room. Answer: B. Wear gloves and gown when providing care. Rationale: C. Difficile spores are resistant to alcohol. Contact precautions with gown and gloves and strict hand washing with soap and water prevent transmission. Question 13. A client with acute pancreatitis develops sudden onset of hypotension, tachycardia, and cool, clammy skin. What is the priority nursing action? A. Start IV fluid bolus and monitor vital signs. B. Administer morphine for pain control. C. Place client in Trendelenburg position. D. Apply oxygen via nasal cannula. Answer: A. Start IV fluid bolus and monitor vital signs. Rationale: signs indicate hypovolemic shock from third spacing. Rapid fluid resuscitation is critical to restore perfusion. Question 14. A nurse is preparing to administer a blood transfusion and notes the client has a history of severe allergic reactions. What is the best nursing action? A. Premedicate with acetaminophen and diphenhydramine. B. Administer the blood slowly without premedication. C. Obtain a type and cross-match before transfusion. D. Use a blood filter during administration. Answer: A. Premedicate with acetaminophen and diphenhydramine. Rationale: premedication reduces the risk of allergic transfusion reactions in high-risk clients. Question 15. A client receiving vancomycin develops redness and flushing of the upper body during infusion. What should the nurse do first? A. Slow the infusion rate and monitor the client. B. Stop the infusion immediately. C. Administer epinephrine. D. Apply cool compresses to the affected area. Answer. A. Slow the infusion rate and monitor the client. Rationale: this reaction, red man syndrome, is due to rapid infusion. Slowing the rate often resolves symptoms. Question 16. A client with heart failure has a new prescription for digoxin. The nurse notes a potassium level of 3.0 milliequivalent per liter. What is the nurse's priority? A. Administer digoxin as ordered. B. Hold digoxin and notify the provider. C. Encourage a potassium-rich diet. D. Check apical pulse before administration. Answer. B. Hold digoxin and notify the provider. Rationale: hypokalemia increases digoxin toxicity risk. Digoxin should be held until potassium is corrected. Question 17. A client receiving IV heparin reports sudden chest pain and shortness of breath. What is the nurse's immediate action? A. Stop the heparin infusion and call the provider. B. Administer oxygen and assess vital signs. C. Prepare to administer protamine sulfate. D. Obtain an ECG. Answer. A. Stop the heparin infusion and call the provider. Rationale: symptoms suggest pulmonary embolism. Heparin must be stopped pending evaluation to prevent further clotting complications. Question 18. A nurse is caring for a client post-thyroidectomy who reports tingling around the mouth and fingers. What should the nurse assess first? A. Serum calcium level. B. Respiratory rate. C. Neck dressing for bleeding. D. Pain level. Answer. A. Serum calcium level. Rationale: tingling indicates possible hypocalcemia due to parathyroid gland injury during surgery, which requires urgent correction. Question 19. A client with chronic obstructive pulmonary disease, COPD, on 2L per min oxygen develops confusion and drowsiness. What is the nurse's priority action? A. Increase oxygen flow to 4L per min B. Call the respiratory therapist. C. Assess oxygen saturation and notify provider. D. Encourage deep breathing exercises. Answer. C. Assess oxygen saturation and notify provider. Rationale: excess oxygen can cause CO2 retention in COPD clients, leading to respiratory depression. Assessment guides safe oxygen therapy. Question 20. A nurse is preparing to administer for vancomycin. What is the safest infusion rate to prevent toxicity? A. 5 mg per min B, 10 mg per minute. C. 15 mg per min D, 30 mg per minute. Answer. A. 5 mg per min. Rationale: vancomycin should be infused over at least 60 minutes, approximate 5 to 10 mg per min, to prevent red man syndrome and nephrotoxicity. Question 21. A client on continuous heparin infusion has an APTT level of 120 seconds, therapeutic range 60 to 80. What should the nurse do? A. Increase the heparin rate. B. Decrease the heparin rate and notify provider. C. Hold the heparin and check platelet count. D. Continue current dose and reassess in 6 hours. Answer. B. Decrease the heparin rate and notify provider. Rationale: APTT above therapeutic range increases bleeding risk. Dose adjustment is needed. Question 22. A nurse is preparing to administer oral digoxin. Which assessment finding contraindicates administration? A. Apical pulse 58 BPM. B. Blood pressure 120 over 70 millimeters of mercury. C. Respirations 18 per min D. Potassium 4.0 milliequivalent per liter. Answer. A. Apical pulse 58 BPM. Rationale: digoxin slows heart rate. It should be withheld if apical pulse is less than 60 bpm to avoid bradycardia. Question 23. A client with sepsis is receiving norepinephrine infusion. The nurse notices the foresite is swollen and cool with blanching. What is the priority action? A. Apply warm compresses and elevate limb. B. Stop the infusion and notify the provider. C. Slow the infusion rate. D. Document the findings and continue monitoring. Answer. B. Stop the infusion and notify the provider. Rationale: norepinephrine extravasation causes tissue necrosis. Infusion must be stopped immediately to prevent injury. Question 24. A nurse caring for a client on warfarin notes bruising and petechiae. The INR is 5.8. What is the nurse's best action? A. Administer vitamin K as ordered and notify provider. B. Continue warfarin and monitor for bleeding. C. Encourage the client to avoid vitamin K-rich foods. D. Increase warfarin dose to maintain INR. Answer. A. Administer vitamin K as ordered and notify provider. Rationale: high INR with bleeding signs indicates warfarin toxicity. Reversal with vitamin K is necessary. Question 25. A client with a chest tube after pneumothorax suddenly develops respiratory distress and absent bubbling in the water seal chamber. What should the nurse do? A. Clamp the chest tube and call the provider. B. Check for kinks or disconnection in the tubing. C. Strip the chest tube to clear clots. D. Encourage deep breathing exercises. Answer. B. Check for kinks or disconnection in the tubing. Rationale: absence of bubbling may indicate tubing obstruction or disconnection. Nurse must assess equipment before other interventions. Question 26. A client with chronic kidney disease, CKD, is receiving erythropoietin therapy. The nurse notes the client's blood pressure is 180 over 100 millimeters of mercury. What is the best nursing action? A. Hold erythropoietin and notify the provider. B. Administer antihypertensives as prescribed. C. Increase fluid intake to reduce hypertension. D. Document the finding and continue therapy. Answer. A. Hold erythropoietin and notify the provider. Rationale: erythropoietin can increase blood pressure. Uncontrolled hypertension is a contraindication and requires provider notification before continuing therapy. Question 27. A nurse is caring for a client with a tracheostomy who suddenly develops increased respiratory distress and noisy breathing. What is the priority action? A. Suction the tracheostomy tube. B. Increase oxygen flow rate. C. Check for tracheostomy tube obstruction. D. Call respiratory therapy. Answer. C. Check for tracheostomy tube obstruction. Rationale: sudden distress and noisy breathing indicate possible obstruction. Immediate assessment and clearance are critical. Question 28. A client with a history of deep vein thrombosis is prescribed rivaroxaban. The client reports new onset, severe headache and dizziness. What should the nurse do first? A. Continue medication and monitor symptoms. B. Hold medication and notify the provider. C. Encourage hydration and rest. D. Administer acetaminophen for headache. Answer. B. Hold medication and notify the provider. Rationale: severe headache and dizziness may indicate intracranial bleeding, a serious adverse effect of anticoagulants. Medication should be held and provider notified immediately. Question 29. A nurse is preparing to administer insulin glargine to a client. Which action is most important? A. Administer insulin immediately after meals. B. Rotate injection sites to prevent lipodystrophy. C. Mix glargine with regular insulin in the same syringe. D. Monitor blood glucose closely for hypoglycemia risk. Answer. D. Monitor blood glucose closely for hypoglycemia risk. Rationale: Insulin glargine has a long duration. Careful monitoring prevents dangerous hypoglycemia. It should not be mixed with other insulins. Question 30. A client with heart failure is prescribed spironolactone. Which lab value indicates a need to withhold the medication? A. Sodium 138 milliequivalent per liter. B. Potassium 5.8 milliequivalent per liter. C. Creatinine 1.2 milligrams per deciliter. D. BUN 20 milligrams per deciliter. Answer: B. Potassium 5.8 milliequivalent per liter. Rationale: spironolactone is potassium-sparing. Hyperkalemia greater than 5.0 contraindicates its use to prevent cardiac toxicity. Question 31. A client develops a new onset rash and fever 10 days after starting phenytoin. What is the priority nursing action? A. Administer antihistamines as prescribed. B. Hold the medication and notify the provider. C. Apply topical corticosteroids to rash. D. Document the rash and continue monitoring. Answer: B. Hold the medication and notify the provider. Rationale: rash with fever may indicate Stevens-Johnson syndrome, a life-threatening drug reaction requiring immediate cessation of phenytoin. Question 32. A client is receiving high-dose corticosteroids and develops black, tarry stools. What is the nurse's priority action? A. Monitor stool for occult blood regularly. B. Notify the healthcare provider immediately. C. Encourage increased dietary fiber. D. Administer stool softeners. Answer: B. Notify the healthcare provider immediately. Rationale: black, tarry stools indicate GI bleeding, a serious complication of corticosteroids requiring urgent evaluation. Question 33. A nurse is caring for a client receiving amphotericin B. Which assessment finding is most concerning? A. Mild fever and chills during infusion. B. Serum creatinine increase from 1 to 2.2 milligrams per deciliter. C. Mild nausea and vomiting. D. Transient hypotension during infusion. Answer: B. Serum creatinine increase from 1 to 2.2 milligrams per deciliter. Rationale: amphotericin B is nephrotoxic. Rising creatinine indicates kidney injury requiring intervention. Question 34. A client with liver cirrhosis is prescribed lactulose. The nurse notes the client is becoming increasingly confused and agitated. What should the nurse do? A. Hold lactulose and notify the provider. B. Increase lactulose dosage to clear ammonia. C. Monitor ammonia levels closely. D. Assess for signs of dehydration. Answer: D. Assess for signs of dehydration. Rationale: lactulose can cause dehydration and electrolyte imbalance, worsening encephalopathy. Hydration status must be evaluated first. Question 35. A client with Parkinson's disease is prescribed levodopa or carbidopa. Which client statement indicates understanding? A. I will avoid taking this medication with high-protein meals. B. I should take this medication only when symptoms worsen. C. I can stop this medication if I feel nauseated. D. I will take this medication once a week. Answer: A. I will avoid taking this medication with high-protein meals. Rationale: high-protein meals interfere with absorption of levodopa. Medication timing around meals is important for effectiveness. Question 36. A client receiving methotrexate for rheumatoid arthritis develops mouth sores and diarrhea. What is the nurse's best action? A. Administer antidiarrheal medication. B. Hold methotrexate and notify the provider. C. Encourage increased fluid intake. D. Provide mouth care and monitor nutrition. Answer: B. Hold methotrexate and notify the provider. Rationale: mouth sores and diarrhea indicate mucositis and possible toxicity. Methotrexate must be withheld and provider contacted. Question 37. A nurse is teaching a client about the signs of lithium toxicity. Which symptoms should the client report immediately? A. Mild hand tremors. B. Increased thirst and urination. C. Persistent vomiting and diarrhea. D. Drowsiness and dry mouth. Answer: C. Persistent vomiting and diarrhea. Rationale: GI symptoms can rapidly lead to dehydration and worsen lithium toxicity, requiring urgent medical attention. Question 38. A client is started on phenytoin and develops a fever, sore throat, and rash. What is the nurse's priority action? A. Continue phenytoin and give antipyretics. B. Hold phenytoin and notify the provider. C. Administer diphenhydramine for rash. D. Document symptoms and monitor. Answer: B. Hold phenytoin and notify the provider. Rationale: symptoms indicate possible serious hypersensitivity reaction stress syndrome. Medication must be stopped immediately. Question 39. A nurse is caring for a client who received a blood transfusion 15 minutes ago and develops itching, urticaria, and wheezing. What is the priority nursing action? A. Stop the transfusion and administer epinephrine. B. Slow the transfusion rate and notify the provider. C. Apply cool compresses and monitor. D. Administer diphenhydramine and continue transfusion. Answer: A. Stop the transfusion and administer epinephrine. Rationale: signs indicate an anaphylactic reaction. Immediate cessation and emergency treatment are required. Question 40. A client with a tracheostomy has thick, tenacious secretions and difficulty clearing the airway. What is the best nursing action? A. Encourage coughing and deep breathing. B. Perform tracheal suctioning using sterile technique. C. Increase IV fluids. D. Humidify the oxygen. Answer: B. Perform tracheal suctioning using sterile technique. Rationale: thick secretions obstruct airway. Suctioning clears secretions and maintains airway patency. Question 41. A client receiving dopamine infusion develops tachycardia and chest pain. What should the nurse do first? A. Decrease the dopamine infusion rate. B. Administer nitroglycerin as ordered. C. Notify the healthcare provider immediately. D. Obtain a 12-lead ECG. Answer: A. Decrease the dopamine infusion rate. Rationale: tachycardia and chest pain can be caused by dopamine's cardiac effects. Reducing dose may reduce symptoms while provider is notified. Question 42. A nurse is caring for a client with a central line who develops redness, swelling, and tenderness at the insertion site. What is the priority action? A. Apply warm compresses to the site. B. Obtain blood cultures and notify the provider. C. Remove the central line immediately. D. Administer antibiotics as prescribed. Answer: B. Obtain blood cultures and notify the provider. Rationale: signs indicate possible line infection. Blood cultures are necessary before antibiotics. Removal depends on provider order. Question 43. A client receiving IV heparin has an activated partial thromboplastin time, APTT, of 90 seconds, therapeutic range 60 to 80. What should the nurse do? A. Increase the heparin dose. B. Hold the heparin and notify the provider. C. Continue the current dose and recheck in 6 hours. D. Administer protamine sulfate. Answer: B. Hold the heparin and notify the provider. Rationale: elevated APTT increases bleeding risk. Dose should be held and provider notified for adjustment. Question 44. A client with diabetes reports dizziness, sweating, and palpitations 30 minutes after receiving insulin. What is the nurse's best immediate action? A. Check blood glucose level. B. Provide a snack with complex carbohydrates. C. Administer glucagon injection. D. Notify the provider. Answer: A. Check blood glucose level. Rationale. Symptoms suggest hypoglycemia. Confirming blood glucose guides immediate treatment. Question 45. A nurse is caring for a client on warfarin therapy scheduled for surgery. Which instruction is essential to give the client? A. Continue warfarin until surgery day. B. Avoid green leafy vegetables. C. Notify the surgical team about warfarin use. D. Stop warfarin 1 day before surgery. Answer. C. Notify the surgical team about warfarin use. Rationale. The surgical team needs to manage warfarin to reduce bleeding risk. Stopping medication timing must be provider-directed. Question 46. A client with chronic obstructive pulmonary disease, COPD, is prescribed high-dose corticosteroids. Which lab value requires immediate attention? A. Blood glucose 250 mg per deciliter. B. Potassium 4.2 milliequivalent per liter. C. White blood cell count 6,000 per millimeter cube. D. Serum sodium 140 milliequivalent per liter. Answer. A. Blood glucose 250 mg per deciliter. Rationale. Corticosteroids cause hyperglycemia. Elevated glucose needs management to prevent complications. Question 47. A nurse is caring for a client with a new diagnosis of myasthenia gravis who is prescribed pyridostigmine. Which symptom indicates the need to hold the medication and notify the provider? A. Increased salivation and sweating. B. Difficulty swallowing and increased muscle weakness. C. Improved muscle strength. D. Mild abdominal cramping. Answer. B. Difficulty swallowing and increased muscle weakness. Rationale. Symptoms indicate possible cholinergic crisis, which requires stopping medication and immediate evaluation. Question 48. A client on digoxin therapy develops nausea, vomiting, and visual disturbances. What is the nurse's priority action? A. Hold digoxin and check serum digoxin level. B. Administer antiemetics. C. Encourage fluids. D. Monitor vital signs closely. Answer. A. Hold digoxin and check serum digoxin level. Rationale. Symptoms are signs of digoxin toxicity requiring medication hold and serum level check. Question 49. A client with chronic kidney disease has a potassium level of 6.2 milliequivalent per liter. Which prescribed medication should the nurse question? A. Calcium gluconate. B. Sodium polystyrene sulfonate. C. Spironolactone. D. Regular insulin with glucose. Answer. C. Spironolactone. Rationale. Spironolactone is potassium-sparing and contraindicated in hyperkalemia. Other medications are for lowering potassium. Question 50. A client receiving total parenteral nutrition, TPN, develops sudden shortness of breath, chest pain, and tachycardia. What is the nurse's priority action? A. Stop the TPN infusion and notify the provider. B. Administer oxygen via nasal cannula. C. Assess the insertion site for infiltration. D. Obtain vital signs and continue monitoring. Answer. A. Stop the TPN infusion and notify the provider. Rationale. Sudden symptoms may indicate air embolism or catheter-related complication. Stopping infusion and notifying provider are urgent. Question 51. A client with septic shock is receiving norepinephrine via central line. The nurse notes the IV site is swollen, cool, and pale. What is the priority action? A. Slow the norepinephrine fusion rate. B. Stop the infusion and notify the provider immediately. C. Apply warm compresses and elevate the extremity. D. Document the findings and continue to monitor. Answer. B. Stop the infusion and notify the provider immediately. Rationale. Norepinephrine extravasation causes tissue necrosis. Immediate cessation and provider notification prevent serious injury. Question 52. A nurse is caring for a client with a new diagnosis of Addison's disease. Which symptom requires immediate intervention? A. Fatigue and weakness. B. Hypotension and confusion. C. Weight loss and salt craving. D. Hyperpigmentation of the skin. Answer: B. Hypotension and confusion. Rationale: hypotension and confusion suggest adrenal crisis, a life-threatening emergency needing urgent treatment. Question 53. A client on continuous oxygen therapy at 4 L per min via nasal cannula develops worsening respiratory distress and drowsiness. What should the nurse do first? A. Increase oxygen flow to 6 L per min. B. Assess respiratory rate and oxygen saturation. C. Notify the provider immediately. D. Encourage the client to cough and deep breathe. Answer: B. Assess respiratory rate and oxygen saturation. Rationale: assessment is the first step to identify cause before changing therapy or notifying provider. Question 54. A client on digoxin therapy has an apical pulse of 52 BPM and reports nausea and blurred vision. What is the nurse's priority action? A. Administer digoxin and monitor closely. B. Hold digoxin and notify the provider. C. Encourage the client to rest. D. Check blood pressure before administration. Answer: B. Hold digoxin and notify the provider. Rationale: bradycardia and toxicity symptoms require withholding digoxin and prompt provider notification. Question 55. A nurse is assessing a client receiving total parenteral nutrition, TPN. Which finding indicates a potential complication? A. Blood glucose of 180 milligrams per deciliter. B. Temperature of 101.5 degrees Fahrenheit 38.6 degrees Celsius. C. Weight gain of 1 pound in 3 days. D. Decreased urine output. Answer: B. Temperature of 101.5 degrees Fahrenheit 38.6 degrees Celsius. Rationale: fever may indicate catheter-related bloodstream infection, a serious TPN complication requiring immediate attention. Question 56. A client with congestive heart failure is prescribed lisinopril. Which client report requires immediate attention? A. Dry cough. B. Facial swelling and difficulty swallowing. C. Dizziness upon standing. D. Increased urination. Answer: B. Facial swelling and difficulty swallowing. Rationale: these are signs of angioedema, a life-threatening adverse effect requiring emergency care. Question 57. A client with type 1 diabetes is admitted with diabetic ketoacidosis, DKA. Which lab result requires the nurse to intervene immediately? A. Serum glucose 450 milligrams per deciliter. B. Serum potassium 2.9 milliequivalent per liter. C. Serum bicarbonate 15 milliequivalent per liter. D. Arterial pH 7.25. Answer: B. Serum potassium 2.9 milliequivalent per liter. Rationale: hypokalemia can cause life-threatening arrhythmias and must be corrected before insulin therapy continues. Question 58. A nurse is caring for a client receiving amphotericin B. Which assessment requires urgent intervention? A. Mild chills during infusion. B. Increased creatinine from 1 to 2.3 milligrams per deciliter. C. Mild nausea and vomiting. D. Transient hypotension during infusion. Answer: B. Increased creatinine from 1 to 2.3 milligrams per deciliter. Rationale: amphotericin B nephrotoxicity is dose-limiting. Rising creatinine requires provider notification and possible therapy adjustment. Question 59. A client with atrial fibrillation is prescribed warfarin. Which client statement indicates a need for further teaching? A. I will have my blood tested regularly. B. I will avoid eating large amounts of leafy greens. C. I will stop the medication if I feel tired. D. I will inform all healthcare providers about my medication. Answer: C. I will stop the medication if I feel tired. Rationale: stopping warfarin without provider consultation increases clot risk. Fatigue alone is not an indication to stop therapy. Question 60. A nurse is caring for a client who develops sudden onset chest pain and dyspnea during a blood transfusion. What is the first action? A. Slow the transfusion rate. B. Stop the transfusion immediately. C. Administer oxygen. D. Notify the provider. Answer: B. Stop the transfusion immediately. Rationale: sudden chest pain and dyspnea may indicate transfusion reaction. Immediate cessation prevents worsening. Question 61. A client with chronic liver disease is prescribed lactulose. The nurse notes the client has increasing confusion and dehydration. What is the nurse's priority action? A. Hold lactulose and notify the provider. B. Increase fluid intake to prevent dehydration. C. Monitor ammonia levels. D. Encourage frequent ambulation. Answer: B. Increase fluid intake to prevent dehydration. Rationale: lactulose causes dehydration. Hydration reduces risk of worsening encephalopathy and confusion. Question 62. A client with a central venous catheter has redness and purulent drainage at the insertion site. What is the nurse's best action? A. Apply sterile dressing and monitor. B. Obtain a wound culture and notify the provider. C. Flush the catheter with saline. D. Remove the catheter immediately. Answer: B. Obtain a wound culture and notify the provider. Rationale: infection requires culture to guide treatment. Removal depends on provider order. Question 63. A client with COPD reports increased sputum production and fever. Which action should the nurse prioritize? A. Obtain sputum culture and notify the provider. B. Increase oxygen flow rate. C. Encourage the client to rest. D. Administer bronchodilators as scheduled. Answer: A. Obtain sputum culture and notify the provider. Rationale: infection is suspected. Sputum culture guides antibiotic therapy. Question 64. A client receiving digoxin has a potassium level of 3.0 milliequivalent per liter. What is the nurse's best action? A. Administer digoxin as prescribed. B. Hold digoxin and notify the provider. C. Encourage potassium-rich foods. D. Monitor for signs of toxicity. Answer: B. Hold digoxin and notify the provider. Rationale: hypokalemia increases risk of digoxin toxicity. Medication should be held until potassium is corrected. Question 65. A nurse is caring for a client with a chest tube who suddenly reports shortness of breath and decreased breath sounds on the affected side. What is the priority intervention? A. Check chest tube patency and connections. B. Clamp the chest tube immediately. C. Notify the provider and prepare for chest X-ray. D. Encourage deep breathing and coughing. Answer: C. Notify the provider and prepare for chest X-ray. Rationale: sudden respiratory distress may indicate pneumothorax or chest tube malfunction. Prompt evaluation is essential. Question 66. A client receiving IV gentamicin develops tinnitus and dizziness. What is the nurse's priority action? A. Continue infusion and monitor. B. Hold gentamicin and notify the provider. C. Administer antiemetics. D. Encourage fluid intake. Answer: B. Hold gentamicin and notify the provider. Rationale: these are signs of ototoxicity. Medication should be held to prevent permanent hearing loss. Question 67. A client on long-term corticosteroid therapy reports increased thirst, frequent urination, and blurred vision. What should the nurse suspect? A. Onset of diabetes mellitus. B. Corticosteroid-induced fluid retention. C. Dehydration. D. Electrolyte imbalance. Answer: A. Onset of diabetes mellitus. Rationale: corticosteroids can cause hyperglycemia and steroid-induced diabetes. Symptoms require further evaluation. Question 68. A nurse notes sudden swelling, redness, and warmth in a client's calf who is on bed rest. What is the nurse's priority action? A. Apply warm compresses and elevate the leg. B. Notify the provider and prepare for diagnostic tests. C. Encourage ambulation. D. Administer pain medication as ordered. Answer: B. Notify the provider and prepare for diagnostic tests. Rationale: signs indicate possible deep vein thrombosis, DVT. Prompt diagnosis and treatment are critical. Question 69. A client with heart failure develops jugular vein distension, crackles in lungs, and 4+ pitting edema. What is the nurse's priority intervention? A. Administer prescribed diuretics and monitor response. B. Restrict oral fluids and sodium intake. C. Elevate legs and monitor urine output. D. Prepare for echocardiogram. Answer: A. Administer prescribed diuretics and monitor response. Rationale: signs indicate fluid overload. Diuretics reduce preload and improve symptoms. Question 70. A client receiving heparin therapy has a platelet count decrease from 220,000 to 90,000 per millimeter cube in 3 days. What is the nurse's best action? A. Continue heparin and monitor platelet count. B. Hold heparin and notify the provider for suspected hit. C. Administer platelet transfusion. D. Increase heparin dose. Answer: B. Hold heparin and notify the provider for suspected hit. Rationale: rapid drop in platelets suggests heparin-induced thrombocytopenia, which requires immediate discontinuation. Question 71. A client with acute asthma exacerbation is prescribed methylprednisolone IV. What is an important nursing consideration? A. Monitor blood glucose levels regularly. B. Encourage fluid restriction. C. Avoid use of nebulized bronchodilators. D. Administer only once daily in the morning. Answer: A. Monitor blood glucose levels regularly. Rationale: corticosteroids cause hyperglycemia. Glucose monitoring prevents complications. Question 72. A nurse is caring for a client with elevated serum potassium, 6.0 milliequivalent per liter. Which prescribed medication should the nurse question? A. Calcium gluconate. B. Sodium polystyrene sulfonate. C. Spironolactone. D. Regular insulin with glucose. Answer: C. Spironolactone. Rationale: spironolactone is potassium-sparing and contraindicated in hyperkalemia. Question 73. A client with acute pancreatitis is prescribed morphine. The client reports severe abdominal pain despite medication. What is the nurse's best action? A. Administer additional morphine dose. B. Notify the provider immediately. C. Encourage the client to lie flat. D. Apply heat to the abdomen. Answer: B. Notify the provider immediately. Rationale: severe pain despite opioids may indicate complications like pancreatic necrosis or abscess needing urgent evaluation. Question 74. A client receiving IV potassium chloride develops muscle weakness and irregular pulse. What is the nurse's priority action? A. Continue infusion at a slower rate. B. Stop infusion and notify the provider immediately. C. Administer calcium gluconate. D. Encourage oral potassium intake. Answer: B. Stop infusion and notify the provider immediately. Rationale: signs indicate hyperkalemia, which can cause fatal arrhythmias. Urgent intervention is required. Question 75. A nurse is caring for a client with multiple sclerosis, experiencing muscle spasticity. Which medication should the nurse expect to administer? A. Baclofen. B. Levodopa. C. Diazepam. D. Phenytoin. Answer: A. Baclofen. Rationale: Baclofen is a muscle relaxant used to reduce spasticity in MS patients. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.